Hello, my name is Alicia Prather and I'm a nurse practitioner student at Auburn University. Today I would like to discuss interstitial cystitis. Interstitial cystitis, also known as bladder pain syndrome, is a chronic, painful bladder condition that causes urinary urgency and frequency, as well as pain, pressure, and discomfort that are perceived to be coming from the bladder. The exact cause of IC remains a mystery, but researchers have developed a number of different factors that may contribute to the development of this condition. Many researchers believe a trigger caused by one or more events that may initially damage the bladder or bladder lining and ultimately lead to the development of IC. Some of these triggers may be bladder trauma, bladder overdistension, autoimmune disorder, bacterial infection, primary neurogenic inflammation, and spinal cord trauma. Initial evaluation of IC includes a patient history, physical exam, and review of symptoms. 4 key diagnostic clues that may indicate IC are 1, bladder and pelvic pain or discomfort, 2, urinary urgency and frequency, 3, symptoms that persist for more than 6 weeks, and 4, negative results of lab tests checking for urinary tract or other infection. Key questions to ask in the workup of interstitial cystitis includes symptoms the patient is having and for how long, current and past health problems, the patient's diet, and what kinds of liquids do they drink during the day. Symptoms of IC feel like those of a bladder infection, although no infection is present, and range from mild to severe and can go into remission or flare-up. These include frequency, which is the need to urinate 8 or more times a day and more than once at night. Urgency, which is the urgent need to urinate even right after a trip to the bathroom, accompanied by pain, burning, or bladder spasms. Pelvic pain, which is pain and tenderness in the lower abdomen, genital area during sex, or pain that gets better or worse as the bladder empties. During the physical exam, the provider checks the abdomen and pelvic area for tenderness. This helps the provider better understand the causal symptoms and look for abnormal growths in the pelvic area, vaginitis, urethritis, prostatitis, and other conditions that can cause pelvic pain and discomfort that is similar to IC. Because IC symptoms are similar to those of other disorders of the bladder and there is no definitive test to identify IC, providers must rule out other treatable conditions before considering a diagnosis of IC. The diagnosis of IC is based on the presence of pain related to the bladder, usually accompanied by frequency and urgency, and the absence of other diseases that could cause the symptoms, such as a urinary tract infection. Once other conditions are excluded, patients with characteristic signs and symptoms generally are treated for presumed IC. Treatment for IC is 5 phases. The first phase includes lifestyle modification. With careful attention, most people can identify and avoid triggers that make their IC symptoms worse. Common triggers include acidic or tart foods, caffeine, carbonated beverages. The second phase includes oral medications such as Elmiron, hydroxyzine, and amitriptyline. Third phase includes neuromodulation, bladder ulcer cauterization, and injections such as Botox. Fourth phase, which is cyclosporin. When other treatments have not been successful, cyclosporin can be used. If that is ineffective, the 5th and final phase is surgery. Major surgery should be reserved for patients with severe unresponsive disease and who are willing to accept the risk and lifelong changes associated with surgery. Surgery can be offered to patients with severely limited bladder capacity or severe symptoms that have not responded to other therapies. Patient teaching includes that patients pay close attention to their diet and avoid foods that cause IC flare-ups. It's one of the most effective things that a patient can do to control symptoms. Stress, avoiding certain activities or stresses can make IC BPS worse. Clothing. Some people find that wearing modified clothing helps them avoid the pelvic muscle tension that can trigger pelvic pain. Can IC be cured? Interstitial cystitis is a chronic condition, but the symptoms can go into remission. This means that they may go away for a period of time or they are milder. The goal of treatment is to reduce symptoms so that the patient can function at their best despite having IC. Thank you for your time. Hope you have enjoyed this presentation.